We all desire to live a long and healthy life. And to achieve this, you need to be aging well. And that's why today's guest is Dr. Amy Brenner. Welcome to Beyond Diagnosis, a podcast to raise your awareness, decisions, and voice for alternative practices so you can take back control of your health. I'm Rita Michele, your host, a mindset and empowerment coach, and the founder of the ONUS platform. Join me each week so you can create the health of your dreams. A renowned board-certified gynecologist, certified in functional medicine, and certified in anti-aging medicine, who has been treating women with a whole body approach for over a decade. Welcome, Dr. Amy, to the show.
Hi, Rita. Thanks so much for having me.
Oh, you're welcome. You know, aging well, everyone has longevity on their mind. You know, they want to live a long life for various reasons, whether it's, family or just life experiences, whatever it is. But you don't want to be living a long life if you're not living it well. If you're sick,
Absolutely.
you got aches and pains, whatever. As a practicing gynecologist, you felt that the traditional methods of giving out medication, just lifestyle changes, maybe mindset changes or whatever, were only giving you subpar results. So why do these methods fall short?
I think that's a great question and a great place to start. And I couldn't agree more. We all want to live a long life, a long lifespan, but having a good health span of being healthy during that life, is really important. So you don't want to be spending, the second half of your life just coming home and watching TV all night long. People want to be active. So it's so important. And I would say that I think that medical school and training for physicians is the typical allopathic approach of
Mm.
the patient tells me a problem, I give them a diagnosis, and then pretty much I give them a drug or do a surgery to fix that problem. And I found that it really didn't help a lot of people. And I think also in the traditional medicine world where you're seeing patients every 10, 15 minutes, where in reality you only have 5 to 8 minutes to spend with patients, you don't have time to go into lifestyle medicine and supplements. If you have time to write a prescription, tear it off, hand it off, and you're off to the next patient. And so I found myself I didn't want to hear the patient complaints because I didn't have the solutions, and I certainly didn't have the time to take care of those patients. And so I started having my own health journey and decided I needed to fix myself. And then once I fixed myself, I decided I needed to share this information and change my model of practice and spend more time with patients so we can really dig deep into what the root cause of the issue is. And so that takes time, and that requires a lot more training that you don't get in the allopathic model that's really disease focused and prescription medication focused.
Yes, yeah, that look at, I find that whole model is about this medication will help with this symptom or whatever you're experiencing, but it's not looking like, why do you have that? Like, why have you got diabetes? Why have you got this rash? Why, the why is missing. And is that why you decided to go into functional medicine and anti-aging medicine? So you could get more to the root cause. And I believe you really take a whole body approach when working
Yes,
with women.
100%. I think also allopathic medicine, another problem is that it's very specialty specific or very systems approached of the cardiologist does this, the GI doctor does this, the gynecologist does this, the endocrinologist does this, but in reality, so many things are related. So,
Mm.
you may think I have a joint problem, I want to go to a rheumatologist, but hormone therapy could help with joint problems. And that's just one example of where you wouldn't think to talk to a gynecologist about joint pain, but joint pain can be, so many issues, and everything is really interrelated. And so that's why it's really important to look at a whole body approach instead of just all these little doctors for all these doctors for different body parts.
Yeah, absolutely. And that siloed approach just doesn't seem to be working. I mean, it's brilliant if you cut your leg off and you're in the ER, or you have something very specific that, but when you need to get to the root cause, you realize that everything's interrelated, interconnected throughout the body. And you can't just, oh, your gallbladder's not working, let me just take that out. Because what
Absolutely.
about all the cascading effects of that? This is what we're really hoping so many of our listeners actually really grasp by interviewing doctors like yourself, that you can't just take one thing. You really have to look at everything and at the root cause of it to find the answer. Otherwise, you're just going to be reliant on medication or even way too many supplements.
Absolutely. So I love the message that you're delivering.
Yeah, thank you. Thank you. So, do you look at it as a prevention? Do you look at it from a prevention, or is it to slow down the aging of disease and dysfunction?
Yeah, I think that's a great question. And I would say it depends. Certainly, I do have many patients who are further along on their health journey, that have listened to a lot of podcasts like yourself, read a lot of functional or anti-aging books, and have lived that lifestyle and are looking to optimize their health. And I call that like health like 301, is they've already taken the basic courses. And so I do have those patients that are coming in and they're already doing the basics and really want to optimize their health, and that's a different conversation. But I would say the majority of the patients are patients that have been around the block with other physicians, and maybe they weren't heard by their primary care or gynecologist, or they were told this is just a normal part of aging, you just need to accept it. But most patients are coming in with a list of common symptoms. I like to call it the 40-year-old syndrome, of a typical block of symptoms that 40-year-old women tend to commonly have.
Yeah.
And then things, if not addressed, can progress, and you can add a few things on for the 50-year-old syndrome. Certainly we see patients of all ages, and that's a different conversation, but most of our patients are coming in with symptoms that they want addressed.
Yes, yes. So, so for our listeners, if they've gone into menopause, or they're perimenopause, they've gone into menopause, or even if they're not coming to you because they think that that's the issue, that they're feeling brain foggy, they've got aches and pains, and whatever their symptom is, what do you look at? So I'm a client, I come to you. What do you look at first with me? What would you
Yeah.
do
So
first?
Rita, can I ask, I think we spoke offline before we started. It sounds like we're similar age, of in that
Yes.
menopausal range. So when women come to us in the perimenopausal or menopausal range, the first thing we do is take a comprehensive history of looking at your medical history, family history, surgical history, gynecologic history, obstetric history. Were there any history of gestational diabetes? what medications that you're on that may or may not be contributing to a side effect. And then we'll do an extensive questionnaire of rating a lot of those common symptoms of mild, moderate, severe, asking about your sleep cycle, your diet, your exercise, what your gut health is like, how often you have a bowel movement, what the consistency of your bowel movement is. So we do an extensive questionnaire. And typical complaints that we hear from patients in the perimenopause and menopause range are vasomotor symptoms. So hot flashes, night sweats, feeling tired, not sleeping well, mood issues, brain fog, issues with concentration, skin changes, typically can be either dry skin or acne or oily skin. Hair loss is a common complaint, issues with libido, vaginal dryness, changes in their period. So those are some common symptoms that we hear. And with those presenting complaints, we like to start by doing a full hormone evaluation. And what that includes is a full thyroid panel. So it's not just a TSH that most doctors are doing. Maybe if we're lucky, somebody will have done a TSH and a T4, but we're doing those tests along with a free T3, some antibodies against your thyroid, a reverse T3. So we're looking at thyroid. We're looking at sex steroids. So that's the estrogens, the testosterone, progesterone. We're looking at adrenal hormones. And I usually start by looking at DHEA and pregnenolone in blood work. Although I do like to tell the patient that that's not the best way to look at adrenal hormones. I think the best way is to actually do a 4-point saliva cortisol test. So if those are off, which most of the time they are, then I'll recommend the patient to do a cortisol test. So we have sex steroids, thyroid, adrenals, and then I like to look at insulin or blood sugar. If somebody's having an issue with weight gain or inability to lose weight, we'll do a 2-hour insulin test where the patient will come in fasting. We'll look at their fasting insulin. They'll eat a certain amount of carbohydrates and we'll measure their insulin 2 hours later. And then we'll do a couple other random things like looking at their C-reactive protein, which is a marker for inflammation, a comprehensive lipid panel, some nutrients that can be tested with serum like vitamin D, B12, zinc, and selenium and ferritin. And that's where we usually start. In an ideal world, it would also be nice if a patient could do a comprehensive stool analysis, but that tends to be a little bit more expensive. That test is not covered by insurance whatsoever. But that's something that I like to talk to patients about as well. And that's typically our initial evaluation.
It's comprehensive, isn't it? It's a lot more comprehensive than, I mean, I remember, and I certainly not bagging, general practitioners or whatsoever. They're very much needed. But I remember going to a general practitioner and saying, I really think I need to have my hormones checked. I'm feeling so tired at the deep core of myself. And, I'm feeling down and, I'm losing hair and, all that sort of thing. And she said, okay, she just did a hormone test through a blood test, like a general blood test. And when I went back, she goes, oh, yeah, you can see you're in menopause.
Yeah.
Thank you. I think I knew that. So it's not this, what you're talking about is broad as in it's comprehensive, but I believe you also work within a narrower framework, like your blood test. You look at markers in a narrower range than the broad, so you can see things happening, and that, I suppose, helps with the prevention side, wouldn't it?
Absolutely. I think that when a woman like yourself is in menopause, or myself, when women initiate hormone therapy, even if they weren't having any symptoms, although most are, but even if they weren't having symptoms, initiating hormone replacement therapy as close to the time of menopause as possible reduces overall mortality and reduces a lot of morbidity or a lot of diseases such as osteoporosis, cardiovascular disease, colon cancer, and dementia. And also keeps the vagina, vulva, and bladder very healthy. So it also reduces a lot of diseases. So I think taking hormones in menopause is like health 101
Yes,
at the
yes.
at the basics of health. And certainly there's a lot of other tests that we could look at if optimizing all of these hormones doesn't give us the results that we're looking for. We have so many other tools in our toolbox, but this is typically where we start for most patients if it hasn't been done yet.
Right. So it sounds like that the hormones are a major player in, and having those symptoms and understanding and recognizing those symptoms are one of the best indicators for aging, not anti-aging, but aging. And that's the whole thing, isn't it? If we want to have a long, fulfilling life, the aging is paramount, how we age.
Absolutely. And, every now and then I'll have a patient who says, I just want to age gracefully and do what's natural. And as it relates to hormones, and what's natural is to start having periods or menarche at age 10 to 12, start having babies right when you're in reproductive age every 2 to 3 years, go through menopause at age 50, and die within 5 to 10 years after menopause. That's what's natural. But now with technology and modern medicine, we have been able to extend our lifespan. And so it is about extending lifespan and about extending health span, and hormone replacement therapy plays a huge role, where women are spending anywhere from 20 to 30 years in the menopause range, and you just don't have to suffer.
That's such a good message, and I hope so many listeners and the people watching this take that away, that you don't need to suffer. It's almost like suffering is part of our right. People seem to subscribe to this suffering, and you really don't have to. You're a really big believer in bioidentical replacement therapy, and I think that has a lot of women confused. What are the myths around BHRT?
Yeah, well, first of all, some people think that the word bioidentical hormone is just a marketing term. And what the real definition of bioidentical hormones mean is that the chemical structure of the molecule is exactly the same as what our body used to make. And that's what bioidentical means versus synthetic or non-bioidentical. The example that I like to give the most is with progesterone, which is a bioidentical hormone, and a synthetic progestin of what's in birth control pills, or in the United States, some hormone replacement therapy called Prempro or FemHRT or Activella. Those are a lot of common oral medications have a synthetic progestin in it. And what that means is they took the drug companies took the molecule of progesterone and changed it just ever so slightly, kind of like the difference between regular sugar and Sweet and Low or Splenda or
Mm,
things like that, where it's
mm,
kind of sort of like sugar, but it's just not quite right. So if you made a cake recipe and used an artificial sweetener like Splenda or Sweet and Low instead of sugar, your cake is not going to come out right at all.
right.
So that's the difference between bioidentical and a synthetic, and our body knows the difference too. So progesterone helps with sleep, helps with mood, doesn't have any negative effects on the breast or cholesterol or blood sugar, versus synthetic progestins have been shown to increase the risk of breast cancer, negatively affect mood, negatively affect weight, and can cause negative effects on blood sugar and cholesterol.
Yeah. I think many women might be, well, a lot of women that I've spoken to are concerned about taking extra estrogen, like estrogen around breast cancer, or now correct me if I say it wrong, testosterone, because straight away they go, no, that's a male hormone. I don't want that. But they are both important, like estrogen doesn't necessarily equal breast cancer.
Absolutely. Rita, you hit the nail right on the head. Those are two of the most other common myths that I am trying to extinguish every day in my practice, is the concern that these hormones cause breast cancer. And that couldn't be further from the truth. Where women got this idea is from the big study called the Women's Health Initiative, where Prempro, which had horse estrogen and a synthetic progestin, that drug it was mainly due to the synthetic progestin, showed that there was almost a statistical increased risk of breast cancer. But the estrogen only arm of that study actually showed that there was a lower risk of breast cancer. So estradiol has not been shown to lower or increase the risk of breast cancer. It actually has been shown to lower the risk of breast cancer in the Women's Health Initiative. There was a French study with over 80,000 women showing that bioidentical progesterone also lowers the risk of breast cancer. And then finally, testosterone, also no evidence that has been shown to increase the risk of breast cancer. We see that in patients who are transgender and taking large doses of testosterone, that testosterone causes breast atrophy, and that those patients have a lower risk of breast cancer. And we just don't see that with testosterone replacement. Your other comment that testosterone is a male hormone. Again, now there isn't in the United States any FDA approved testosterone for women. So we use testosterone from compounding pharmacies, but women actually in the reproductive age make 10 times more testosterone than estrogen. So women make a lot of testosterone, just a lot less than men.
Yeah, did not know that. That is amazing. And for women who are still sort of sitting on the fence around hormone replacement, what what are the benefits? You only know what you know, and you
Right.
only know how good you feel by the way you're feeling. You don't know how much better you can feel, right? Because you haven't experienced it. So what are the benefits? What will they feel by taking this? For anyone who knows that they're low on hormones but they're worried, what can you say to convince them for the benefits of using HRT?
Sure. Well, I already mentioned about how taking hormones close to the time of menopause is going to reduce those diseases of cardiovascular disease, dementia, osteoporosis, keeping your vagina, vulva healthy. But a lot of women think that it's just about getting over the hump of getting through the hot flashes and the night sweats. And it's not like the flu where it's something you just get over. Because the symptoms of low hormones just continue to rage on, even though the majority of people, the hot flashes and night sweats do resolve. So we'll say that somebody's hot flashes and night sweats went away, but it can help with brain fog, concentration, energy, libido, vaginal dryness, painful sex that's due to vaginal dryness, mood, building muscle, aches and pains. I know me personally, like when I went through menopause, all my my fingers and were hurting. And then when I realized I was in menopause and needed to add estrogen to my regimen of testosterone and progesterone, that symptom of my hands just hurting significantly improved. So joint pain can be an issue. Sometimes even women have mood issues or panic attacks that they notice that worsened with menopause, that hormone replacement therapy can help as well. Exercise recovery, those are the common things, but estrogen has 300 effects in the body, so it can be sometimes,
Significant.
yes.
It's significant. And menopause does hit the majority of women in their 50s.
Yes, the average age is 52.
52. So if you haven't taken HRT in your 50s because you were sitting on the fence or you were concerned, and now you've gone into your early, say your early 60s, you've just moved over to your 60s, can you start? Is that too late? Is it ever too late to start
No.
taking HRT?
That is a great question. Again, a common question that I deal with daily. And the answer is no, it is never too late. Now, in an ideal world, it's best to take it as close to menopause as possible, because once somebody does go through menopause without hormones, you're at increased risk of those diseases that I just mentioned hormones help with. So maybe you've already developed cardiovascular disease, osteoporosis, significant vaginal atrophy that we have to work on then reversing. So it's just a little bit more difficult, but it doesn't mean that it's a contraindication, and it certainly doesn't mean that it's not going to help somebody.
Well, that's really good to know, especially because some people, it takes years to find someone like you. You know, they've been and
Yes.
they've stayed in the traditional medical system, and, maybe they found someone great, but they're still not quite getting those results, and it does take time to find doctors like yourself.
Yes, or maybe they were told they don't need it, or that it's harmful,
Or it's too late.
or yep, or it's too late, or the hormones cause cancer. Even in the medical community, there's so much misinformation about hormone therapy.
Yeah, absolutely. And another marker, or another thing that I hear a lot about, and I think you talk about as well, is around the anti-aging to be able to age well, is stress and stress relationship with cortisol, and
Yes.
what is the impact of having high cortisol in our body?
Yeah. Again, great question. But cortisol is the master hormone. And, when I tell people your body is under stress, people automatically think that it's mental and emotional stress. And that is a huge component of stress that everybody has in their life. It's just a matter of how you deal with that mental and emotional stress. But although your brain knows the difference between mental and emotional stress, your adrenals, which is the organ that makes cortisol, there are basically four major categories of stress. So we have mental and emotional, blood sugar issues, inflammation, and then sleep. So your brain knows the difference between I'm so stressed that, my dog just died, but your adrenals don't know the difference between my dog just died and my blood sugar does a roller coaster every day. All of those components can be major stresses on the adrenal gland and lead to the first stage is elevated cortisol. The next stage is a normal cortisol but low DHEA. And then this third stage of adrenal dysfunction is low cortisol and a low DHEA. So that's why it's important, in my opinion, to do a saliva cortisol to see where somebody is on the spectrum of adrenal dysfunction. But symptoms of high cortisol could lead to not sleeping, mood issues, weight gain. immune issues of being sick all the time. Too high of cortisol is catabolic, so it can start breaking down tissue and lead to muscle loss, bone loss, poor healing of any kind.
And what are the symptoms of low cortisol? Because not a lot of people, if you go on social media, everyone's talking about high cortisol, and
Right.
they call it, your your belly cortisol or whatever they're saying. It's all about
Yeah.
having a big women having a big belly. So we hear a lot about the high. What are the symptoms of low? No one really talks so much about the low
No, and it's not
cortisol.
as common because it's more of an advanced stage of adrenal dysfunction. A lot of the symptoms can overlap of poor healing, weight issues, but the major difference between the two is somebody with high cortisol tends to be what we call tired and wired, where maybe they're tired all day, but then they get their second wind at bedtime and then they can't fall asleep, versus somebody with low cortisol is just exhausted all the time and to the point where you can't get out of bed. Exercise makes them feel worse. But other than that energy level and just wanting to sleep all the time, there's a lot of symptom overlap. So that's why it's important to test.
Yeah, absolutely. And I really love your point about how the brain knows that you are physically stressed or you might be emotionally stressed or whatever, but your adrenals don't. They don't differentiate. It's just stress for them. So for someone who's maybe experiencing depression or anxiety or, like you said, panic attacks or whatever, that also would have such an impact on your adrenals and the level of cortisol you have in your body. And if you could just clarify for our listeners who aren't sure, where exactly are the adrenals in the body?
They sit right on top of your kidneys.
And their function is to produce hormones, is it?
Yes, they do make some hormones, but that's the main production of cortisol, DHEA, pregnenolone. Um, they also make aldosterone, which regulates our fluid retention. So they make other steroids. So you can't live without your adrenals functioning.
And when they go down, that's when you hear people saying, "Oh, I've got adrenal fatigue," is it?
Yeah, that's an old term, but adrenal fatigue would be the equivalent of very low cortisol. But
Right.
that's kind of in the functional medicine world, a little bit of an outdated term. So now we just call it adrenal dysfunction with either high cortisol or low cortisol.
So now I'm distilling all the information here. Now we've got all this information around optimizing your hormones. Obviously, you have to be careful of your mental and emotional aspect in your life. Um, why it's so good to do hormone replacement. You can do all of that, find the answers, but then you can sabotage yourself with lifestyle choices, can you not? So
A
what?
100%.
So what is
Yes, we
the?
can balance your hormones perfectly and be checking them and replacing them. But if somebody's not doing their work at home from a lifestyle standpoint, we're not going to have as good of a results versus when somebody comes in and is already doing that and then goes through menopause. I can almost guarantee that we're going to have phenomenal results.
Yeah, it is a two-way street, isn't it? You can't expect to put all the power and everything into the hands of a doctor and not play our part and our responsibility towards it.
Right. It's like going to the dentist twice a year for your cleanings, but then going home and not brushing your teeth. You won't have a good result.
Exactly. So in your practice, what do you hear or what do you see of the most common lifestyle choices that people are doing that's accelerating their aging?
Oh, geez. Unfortunately, there's more than just one. I would say that sleep is huge, where patients aren't prioritizing sleep and maybe they think it's more noble to say, oh, I just stay up all night because after the kids go to bed, that's when I do the laundry and the cleaning and that type of thing, or that's when
Mm.
I get all of my like work that I brought home done. And so instead of prioritizing sleep, so sleep is a big one. And then certainly in the United States, our diet and fast food and all the places where you can get fast food and processed food rather than eating real food. Those are the two most common sabotagers of lifestyle.
It would be. And, a lot of your fast food chains have infiltrated here into Australia. We don't have as many as you do, that's for sure, which I'm very happy about. But it is that when you're stressed and running around, you have your work full time, have family, all the rest of it, it is easy to grab fast food of any form. And then also, we didn't discuss about this, but just talking about fast food, I'm thinking, what is your opinion on coffee and the
Yeah, I
hormones?
think a organic, mold-free, um, organic coffee, I think is fine, especially if it's not interfering with your sleep. Now, I've done genetic testing. I'm a slow metabolizer of coffee. So I could never have coffee, in the afternoon or later versus when you go out to dinner and they ask you if you want a cup of coffee with your dessert, I would always say no. Versus my husband is a fast metabolizer and he can drink a cup of coffee after dinner and it doesn't affect him and his sleep. So as long as it's not interfering with your sleep or causing side effects when you're drinking it, of palpitations or maybe even worsening hot flashes, I don't have a problem with a organic, mold-free coffee.
I think that's the key, what you say there, which is I've just found a company here in Australia that I just found on social media actually that says our coffee has been certified to be mold free. Because if it's not mold free and you have, I guess, mold issues or fungus or even histamine maybe issues, that mold will really affect you, wouldn't
Yes,
it?
that can certainly exacerbate things.
Yeah. And I'm so glad that you said the words a slow metabolizer of coffee because you've just taught me about me. There
Yeah.
I would never have thought to say, I would just say, nope, I can't have coffee past 2 o'clock in the afternoon. No way. And even if I do, as I'm aging, I've noticed that there's certain things that I don't cope with as well. I don't cope with alcohol as well. I don't cope with coffee as well. I feel like I have higher histamine issues than what I used to. So that's all part of what we're talking about, isn't it? The whole person approach to
Yes.
aging well,
Yeah,
because
you mentioned alcohol is, I think a lot of women, maybe because they're stressed, have mental and emotional stress, they can't sleep. They think that, having that glass of wine or two at bedtime is going to help things, but it actually can have some significant consequences of interfering with REM sleep, contributing to weight gain. Certainly, any alcoholic beverage is also going to increase the risk of breast cancer. So, um, you know, just
yes,
I think everybody likes that glass of wine, but it can come with some negative consequences.
it certainly can. And that actually brings me to my next question. And this might be a bit of a loaded question, Dr. Amy, because might be a bit challenging in giving a answer, like a short answer to it. But there's so much conflicting advice out on the internet, out of social media, from one doctor to another, from one functional doctor to a different, to a naturopath. Everyone has something different to say, right? And as a consumer or client, patient, whatever, what do you do? Like, there's so much advice on have this food. No, coffee's good for you. Someone else says no, coffee's bad for you. A glass of wine a day. Red wine is actually good because it has antioxidants. Someone else said no, alcohol is all poison. Oh my goodness, if you're looking to help yourself, it's overwhelming. What advice do you have?
Oh, geez. That is a loaded
It
question,
is a
isn't it?
loaded question, isn't
It's
it?
a loaded question. Honestly, I would agree with you. I think that as as a as a patient without being in medicine or without, like, I just feel so blessed that I do have the education that I have, as well as the resources or the knowledge of where to look. And even in my own health of navigating the medical system, as I've had some orthopedic issues, is not settling for that answer and doing your own research. So I do think you need to take the bull by the horn and be the CEO of your own health and try to do as much research as you can. But unfortunately, you are going to get different opinions of, about diet and supplements and hormones and how did you thyroid. And there's just so much variation. I do feel bad for people. So at the end of the day, I think you need to do your research and go with what makes sense with you. In my practice, certainly I like to do a lot of patient education, but I also provide a lot of resources of podcasts that I've done or videos that I've done to educate my patients, and also journal articles and research articles or other books to back up what I've said. So I say, don't just believe me. Here's some additional resources that confirm my belief. Although even with those, sometimes I don't believe every single word that's written in a book that I might recommend to a patient. So I like to provide people with other hard evidence to back up my beliefs.
Yeah, that's great advice because it's really about don't just believe what someone else did on social media. It may not be right for you. It's about doing your research, do your due diligence, and then find someone who resonates with you because everyone's situation is individual and everyone's care plan is going to be different. And you might be lucky that you did copy someone on social media or on the internet or somewhere and it did work for you and
Right.
it worked for them
Then
and it
at the
worked
end
for you.
Yeah, at the end of the day, you also have to find providers that are willing to listen to you and are willing to help you. And we do a lot of things in our practice, but we help a lot of people, but we don't do everything. So, certainly I mentioned the word mold in coffee. And that can certainly be an issue for patients of mold toxicity. And I'm aware of it and what symptoms it is, but that's not something I'm actively treating. But if I was suspicious of this, I would know where to send somebody to deal with mold issues or Lyme disease or heavy metal toxicity. So
Yeah, absolutely. Great advice. And because we like to give people an action at the end, so they're not just listening to this information, it stops and then they just turn around and go back to their normal lifestyle. Is there at least one action our listeners can do today to start aging well?
yes. And I would say, just going off what I said, is just you don't have to accept it. So don't let somebody gaslight you into telling you this is normal, this is just part of an aging. But take charge of your health and find a provider that's willing to listen and willing to help you, because you don't have to just accept it. There are so many things and so many tools in the toolbox that functional providers have to help alleviate some of those symptoms and help you age well with a good health span.
Brilliant advice. Dr. Amy, it has been such a pleasure having you on the show and sharing your knowledge for women, especially going through that menopause stage, which is so important, and how to age well. We're not talking just about, our skin aging here. We're talking about whole body aging, and it's been brilliant listening to your advice. How can people find you? How can they work with you?
Yeah, well, thanks for having me. People can certainly find us on our website, and we have tons of resources on our website, which is www.dramybrenner.com. We can also be found on Facebook, Amy Brenner, MD and Associates, also on Instagram. I also have a podcast. It's called Healthy Her, HealthiHer.
Love it. I love that. Thank you so much. And for everybody, all of the links will be in the show notes. So do go to the show notes, book in. Honestly, this is the way to go if you want to age well, basically. If you want to age well, Dr. Amy's your girl. Thank
Thanks,
you so
Rita.
much. Thank you. I would love to know, what was the biggest insight or aha moment you got from this interview? So you can now speak up, take action, and make informed decisions for your health. And if you like this episode, get instant access to your free ebook, Alternative Wisdom, Taking Back Control of Your Health, at life-onus.com.